Today on The Real Story, fear the corona. The virus's rapid advance prompting Governor Lamont to declare a public health emergency, as experts warn that the threat will spread across the state in the days to come. What's being done to protect you and other citizens? I'll ask the state's Chief Operating Officer, Josh Geballe. Also today, combat veteran Justin Anderson. Now his target is winning a seat in Congress. He's seeking the Republican nomination to run against seven-term Democrat Joe Courtney. What are Anderson's ideas? How does he think Courtney has failed the district? I'll ask him. Also coming up, gun owners at the state capitol to argue against a plan to impose a 35% tax on ammunition, and fighting in court over existing law that limits how many bullets can be loaded into firearms. We have Holly Sullivan, brand new president of the state's largest gun rights organization. She's here with us today on The Real Story. Hi there, you're watching The Real Story. I'm Al TERZI. My colleague Jen Bernstein is enjoying some well-deserved time off today. First, we got to talk about the spread of the coronavirus across America. It's picking up speed as experts warn that it will get a lot worse before it gets better. In response, we're seeing schools close, sports events canceled, a lot of people working from home now, not to mention the frustration of the stores being out of disinfectant and other items in high demand. Governor Lamont this week declared both a public health emergency and a civil preparedness emergency. What does that mean for citizens? Joining me first this morning is Josh Geballe, the state's Chief Operating Officer. Thank you very much.
Pleasure to be here, Al.
Well, let's start with that last thing I talked about. What do we mean by civil defense preparedness emergency as well as a public health emergency?
Yeah, so these are actions that the governor took with consultation and support of the legislative leadership of both parties, very much united, to provide the chief executive with some extraordinary powers to be able to act quickly in the face of significant public health challenges. And so that was put together this week. Initially it was thought of as an opportunity to kind of get out in front of this. The executive orders or the declarations happened at a time where I think we only had one or two confirmed cases at that time.
And where are we now?
Well, we're taping this on Thursday. You know, it's probably not even worth mentioning the statistic. We have 6 positive cases in the state.
It's going to change between now and
By the
Sunday.
time this airs on Sunday, Al, I think we'll see a significant increase. All the public health experts are expecting that we're getting into the phase of what they call community transmission right now, which means that it's passing, particularly in Fairfield County, as it's kind of come across the border from Westchester, where there was a real flare-up and a hot spot there. Viruses don't respect political boundaries, state boundaries, and so we're very focused on that, but most of the experts believe that it's kind of just a matter of time till most communities in our state and in the world really are dealing with some of the effects of this.
There's great concern about the risk to the elderly. Are the people who've been exposed to it or have it in Connecticut generally elderly, or what's the situation? It's
been a bit of a mix, generally so. You're right, though. The elderly are the highest risk group for this particular virus. One of the things that Governor Lamont has been very focused on is taking very decisive action early, before we have widespread cases across the state, particularly because that's what the public health experts say that you can and should do to protect some of these most vulnerable populations.
And a lot of them are in nursing homes, other kinds of facilities like that. Are they up to being able to handle it? And if they're not, what help is available to them?
Yeah, it's going to be a significant challenge for a lot of folks. Even in a normal year when we're just dealing with influenza, about half of the 214 nursing homes in the state will get an outbreak of influenza in the nursing home. So this is a very challenging situation. This is one of the reasons, one of the first actions Governor Lamont took at the beginning of this past week was to issue some very restrictive guidelines on nursing home visitation. At the time, some people criticized us for it because it was very restrictive. Most of the healthcare workers in there, though, applauded it because they know what's coming, and many of the patients and the families too, because they know if a virus gets in there, it's very difficult to control. We've seen what's happened in Washington State, and so the governor really wanted to get out in front of that.
My wife's sister, in fact, is in a facility, and we're very concerned about her. Obviously, we haven't gone there, but we'd love to, but we know it's not proven.
Yeah,
this
is part of the reality of the world we're going to be living in for the next several weeks, possibly a couple of months. Is it's best if people try to not go visit their family and friends, particularly if they're in high-risk categories. Elderly is one, but there's others. If people have an illness, if you have lung disease, heart disease, if you have a compromised immune system, we really need to let those people try to stay away from other people as much as possible to help protect them.
What about the testing business that's underway in some cases now? The feds were criticized for not getting that going sooner. Connecticut, it appears, has done a good job. But now, if I wanted to go get tested, I have a little sniffle right now. Yeah. If I want to go get tested to make sure that I'm not exposed, right. I haven't been exposed to this, can I do that?
So what the medical...
Or does it require a doctor's prescription?
It does. You always have... So here's what people need to think about this. If you start to develop symptoms today in Connecticut that are symptomatic of COVID-19, fever, difficulty breathing, congestion...
Has to be a fever involved.
Fever is characteristic, right. First thing you want to do is you call your doctor. Don't go to the emergency room. Call your doctor first, and they'll help you understand whether or not you do need to go be seen. Really important fact here is that 80 to 85% of the people who get COVID-19 will never go near a hospital. They'll recover at home just like they had the flu, curl up in bed, drink a lot of fluids, and ride it out. But the key is that for those people who will need to go to the hospital, people who will have real difficulty breathing and need medical assistance, there's going to be a lot of those people because of the highly infectious nature of this disease. And so it's critical that we're doing all the things we can to keep the people who are not seriously ill out of the hospitals, away from the hospitals, so that our healthcare system, our wonderful hospitals, have all their resources dedicated on those people who really need it most.
Thank goodness we have the situation we have and the resources we have, because you hear this story like the one that came out of Italy about the woman who had to stay with her husband who had passed away for over a full day, 30 hours I understand, because there was nobody to come and take the body away, and she was in there with her husband lying there dead. Boy, this is something. And it's messing everybody up if people are trying to get the disinfectants and other tissues that they need and that sort of thing. And they're not finding it anywhere in the stores.
Yeah, listen, the next couple months are going to be very challenging for us. Not just people at Connecticut, people all around the world. But what we need to do is we need to stay calm. We need to focus on some of the things I talked about, making sure we're taking the smart actions for the people who are mildly sick. Most of them will just recover at home. Making sure we're doing all the preventative steps now we can do to do what they call social distancing. So another thing that Governor Lamont has been very aggressive about is canceling meetings with over 100 people. Today is Thursday. He used the executive power of the declaration to instruct no more events in the state of Connecticut over 250 people. So that's concerts, sporting events. These are the events where this disease gets transmitted en masse. And by taking these actions early, before
and then it just explodes if it gets
exactly,
like
and that's what happened in Westchester, for example. That's what happened in a nursing home in Washington State. And so by taking these actions early, we give ourselves a chance to spread this out longer and make sure that the peak of infections is more shallow so that our healthcare system can contain that surge.
So the governor here, I'm reading, has now some broad powers to do what he feels necessary. You mean you're talking about executive powers that have been expanded for?
Yes. So for example, today, again, Thursday, he announced that I just mentioned, no more large events over 250. Usually, a governor can't direct private sector enterprises, stadiums and stuff to do things like that. Well, under this declaration, he can. He also waived the 180-day rule. So for schools, there's a state law that you have to have 180 days of school for it to count as an official school year. A lot of our superintendents were struggling with that in the decision around, do I cancel school or not, because am I going to be able to make up the days? So he gave a blanket waiver of that so that superintendents and the people in charge of children's health can make the decision not based on that rule, but based on what's best for the community.
You have enough federal assistance on this?
Yeah, we're getting great support from our federal delegation. We've already received over $7 million in federal funding, and there's more to come.
Well, Josh Geballe, thank you very much for being with us, Chief Operating Officer for the state of Connecticut, and good health to you.
Thank you. You too, Al.
Thank you. Still to come this morning on The Real Story, gun owners speaking out against a proposed 35% excise tax on ammunition. We're going to hear about that from Holly Sullivan. She's the new president of the state's largest gun rights organization, the Connecticut Citizens Defense League. But next, right after a quick break, meet Republican Justin Anderson, a combat veteran running for Congress in eastern Connecticut. But is he ready for the political battlefield, especially challenging a 7-term incumbent like Joe Courtney? Well, he says yes, and he's going to tell us why. And coming up right after the real story, it's Real People with Stan Simpson. On his show today, Reverend Jeff Grant. He's the face of criminal justice reform for white-collar ex-offenders in Connecticut. He's returning to share his fascinating story and how he evolved from a life of greed and arrogance to one of gratitude and service. So stick around for that. You're going to love it. The real story will continue right after this quick break.